Welcome to video number 4, Key Structures and Injection Sites. In the last videos, we addressed technical considerations and positioning. In this video, we will look at landmarks and their echogenic appearance. For this, we will look at the upper of the forearm and the salivary glands. And we'll start with the forearm. Anatomic landmarks can be bones, muscles, tendons, or nerves and vessels. And we'll start and look at an example here. Here you can appreciate the radius, which will appear as a hypoechogenic line here in the middle of the image. Next, we will take a look at the muscle structures. As you see, I begin my examination by using the axial plane, which is great for getting an overview. Muscles can be appreciated in the short axis or in the long axis, and in the short axis they will appear with a speckled image. And in the long axis you will be able to see the fascicles of the muscle. Muscles and muscle groups are confined by a fascia, which appear as a hyperechogenic line. When you move to the insertion points of the muscle, you will come across the myotendinous junction and finally will arrive at the tendinous part, which can be seen here. By moving the fingers of Annika, you can appreciate the movement of the tendons, either by doing it passively like this, or just by asking her to move the fingers. Please, could you move your fingers? This way you can identify your target muscle and just follow it back to the muscle belly. Consider that some muscles may need several injections depending on the volume you want to inject. And also consider anatomic variants, like, for example, the palmaris longus, which is here can be seen here in Annika. Annika, could you please just move your finger like this? And here the palmaris longus can be seen. In some patients, you won't see this muscle. Finally, we will take a look at nerves and vascular structures. For example, here you can see the medianus nerve, which also has a granular or a specular appearance in the axial plane. And lastly, let's take a look at, for example, the arteria brachialis, which also can be identified by using the Doppler. And using ultrasound, you can effectively avoid these structures and avoid to injure them. After identifying the target muscle and the best route of access, you can mark the point of injection by using a marker or by using, for example, the tip of a needle cap. This last technique has the advantage that you leave an indentation in the skin that also will remain after disinfecting this area. Lastly, we'll take a look at the salivary glands. And we will begin by taking a look at the parotid gland, which can be found just anterior to the ear. Note that the salivary gland, like the other glands, has a glandular appearance on ultrasound, and that the salivary gland also is the only gland that can have lymph nodes inside the tissue, like seen here. Next, let's take a look at the glandula submandibularis. The position of this gland can be a little bit variable, and in this case, it appears a little bit more posterior than expected. And in the next video, we will show you how to perform an ultrasound-guided injection.